Hello, my name is Amy Amara. I'm a physician scientist in the Department of Neurology at UAB and a collaborator with the REACT Center, as well as a recipient of pilot funding through REACT. My clinical practice involves treatment of patients with Parkinson's disease and with sleep disorders. And my research interests include evaluation of interventions such as exercise to improve sleep in patients with Parkinson's. Today, I'm going to go over some of the different tools that can be used to measure sleep outcomes in the research setting. First of all, it's important to review why sleep outcomes might be relevant for different research questions or different research settings. Certainly, sleep is important to overall health and should ideally comprise approximately 1/3 of our lives. Although there are different theories about the overall function or purpose of sleep, it's well established that sleep disruption or sleep deprivation, as well as sleep disorders, can be detrimental to overall health. For example, sleep apnea, or pauses during breathing and sleep, if untreated, can lead to increased risk of other health consequences. As an example, stroke is increased risk by 3 to 4 times in patients who have untreated sleep apnea. There's also increase for heart attack or heart failure. It's harder to treat high blood pressure or diabetes in patients who have untreated sleep apnea. It's more likely that those patients might have heart arrhythmias. And untreated sleep apnea makes it harder to lose weight. There's also increased association with COPD or other lung diseases, and untreated sleep apnea is associated with overall mortality. Chronic sleep deprivation, or inadequate time spent sleeping, is associated with increased risk of cardiovascular mortality as well. Further, there is a significant bidirectional relationship between sleep and mood, such that depression can cause poor sleep, and poor sleep can be associated with impairment of mood and worse quality of life. In addition to its impact on overall health, sleep is also important for rehabilitation. For example, sleep impairment can impair athletic performance and also exercise performance. And there have been studies showing that sleep extension can improve performance for basketball players and for tennis players as far as accuracy of serving and accuracy of getting a ball in the hoop. Additionally, sleep disturbances can increase the risk of exercise-related injury, because if someone is sleep deprived or very sleepy, they're more likely to make mistakes and get hurt. There's also a very interesting relationship between exercise and its ability to improve sleep. For example, exercise can increase sleep efficiency, which is the percentage of time spent in bed when you're actually sleeping. It also increases slow wave sleep, which is the deepest, most restorative stage of sleep. It can improve sleep apnea, even independent of losing any weight. And it can improve insomnia as well as subjective sleep quality. Next, we'll go over both the objective and subjective measures that can be used to evaluate sleep, starting with the objective outcomes. First, we'll discuss the gold standard measure of sleep, which is laboratory-based polysomnography, or a sleep study. This includes measurement of the EEG, which is important for staging sleep and evaluating sleep architecture, and also has the ability to measure EMG to assess muscle movements and muscle tone, and this allows us to look at parasomnia. There are advantages of this technique, mainly in that EEG and EMG are present, which are typically not available with home-based sleep studies. Further, there's a technician available to monitor in real time and also is available to provide interventions, such as selective sleep stage disruption or adjusting treatment for sleep apnea. Therefore, laboratory-based polysomnography is useful for many different research questions. This test does include monitoring of EKG, and therefore we can evaluate things like heart rate variability or look for arrhythmias. There's also evaluation of breathing to look at sleep-related breathing disorders, and additional monitoring can be added, such as carbon dioxide monitoring or additional EEG leads or EMG leads to get a better picture of overall sleep. There are, however, some disadvantages of this technique, mainly being that it can be expensive, it sometimes can be hard to get access to, and it does require presence of a trained technician. Further, it monitors a patient away from their home environment, which could alter their sleep outcomes. This is an example of how a sleep technician or sleep researcher can look at the polysomnography. For example, at the top are the eye movements, followed by the EEG leads. There are also the leads to evaluate muscle movements and evaluate breathing effort and airflow through the nose and mouth. Home sleep testing can also be very useful in some research contexts. For example, this does provide a reasonable estimate of sleep apnea severity. There are advantages in that it can be performed in the patient's home environment, therefore making it more comfortable for the patient. However, there are also some disadvantages. For example, this study cannot distinguish between sleep and wake in most situations because there is no EEG monitoring. Therefore, it can underestimate the severity of sleep apnea in some situations. Additionally, if the interest of the research or evaluation of the patient is concerned about evaluating parasomnias, this test is not useful because it does not detect body movements. Another objective measure of sleep is actigraphy. This is a watch-like device that monitors movements through accelerometry and uses different algorithms to estimate sleep time and wake time. This is very useful because it can be used to monitor sleep over days to weeks in the patient's home environment, because they can just wear it for several weeks at a time. It also can be used to monitor sleep and wake over a 24-hour period, which is often not done in the sleep lab. It's also particularly useful for monitoring circadian rhythm sleep disorders, and can also be used to monitor insomnia. For example, in some situations, participants with insomnia have sleep-wake misperception, in which they think they're awake for the entire night but really are sleeping quite a lot. It also has potential to be used to monitor daytime napping. However, the algorithms for this are less reliable than nighttime monitoring. There are some limitations to this technique. For example, it's unable to reliably evaluate latency to sleep onset. There are also various devices and algorithms, so it's important to make sure you research your device and use one that is trustworthy. And then it also can be less reliable in certain patient populations. For example, I mentioned that I study Parkinson's disease, and patients with Parkinson's often have parasomnias that cause them to act out their dreams at night, and therefore, time spent during dream sleep can actually look like time awake if someone is acting out their dreams. However, this is still a potentially useful device. There are also useful objective measures to evaluate daytime sleepiness. For example, in-laboratory testing can include the multiple sleep latency test, as well as the maintenance of wakefulness test. The MSLT, or multiple sleep latency test, can be used to evaluate how easily someone falls asleep. They are given 5 different nap opportunities throughout the day and encouraged to try to fall asleep. And this allows us to evaluate how pathologically sleepy they are. There's also the maintenance of wakefulness test, which is more useful for evaluating the patient's ability to stay awake. This can be useful in patients or participants who drive a truck for a living or do other tasks that require them to stay awake for a long period of time. Another objective measure of daytime sleepiness or vigilance is the psychomotor vigilance task. This is a handheld device that has a light appear on the small black screen, and the patient is supposed to react as quickly as possible and push the button when they see the light appear. This test lasts for 10 minutes and can evaluate the person's ability to stay vigilant over that period of time. Although objective measures are important, they can also be costly or require special equipment or access to a sleep laboratory. Therefore, it's important to have subjective measures available that can also provide useful information in relation specifically to the patient's perception of their sleep quality. There are several useful measures to evaluate the patient's perception of their sleep quality. For example, the Pittsburgh Sleep Quality Index, or PSQI, is a well-established and validated measure in which the patient can respond and report what they feel about their ability to sleep. It's been used in multiple different patient populations, including healthy controls. 2 additional examples of generic sleep questionnaires are the Patient Reported Outcome Measurement Information System, or PROMIS Sleep Questionnaire, and the General Sleep Disturbance Scale. Additionally, sleep diaries can be very useful for understanding the time spent asleep and also to help patients regulate their sleep schedule by making them more aware of when they're asleep and awake. This measure can also be used in conjunction with actigraphy or even on its own to evaluate circadian rhythm sleep disorders. To globally screen for various sleep disorders, there are also questionnaires, and these are 2 examples. The Sleep 50 questionnaire and the Global Sleep Assessment questionnaire can both be used to screen for multiple different sleep disorders and evaluate if someone needs additional assessment with an objective measure or a sleep study. Additionally, there are screening questionnaires that are designed to be specific for certain sleep disorders. For example, sleep apnea has 2 well-known questionnaires, the Berlin questionnaire and the Stop-Bang questionnaire. And Stop-Bang stands for snoring, tired, observed or witnessed apnea, blood pressure, and then bang, BMI, age, neck circumference, and male gender. and these are all particular risk factors for sleep apnea. There are also screening questionnaires for insomnia, including the Insomnia Severity Index, and for restless leg syndrome, including the questionnaire that was designed by the International Restless Leg Syndrome Study Group, or the IRLS. Screening questionnaires for fatigue include the Fatigue Severity Scale. There are also several questionnaires to evaluate daytime sleepiness. For example, very commonly used is the Epworth Sleepiness Scale, which evaluates a participant's likelihood of falling asleep in 8 different situations. There's also the Stanford Sleepiness Scale, which is a single item question where a participant rates their sleepiness right at that very moment. There are questionnaires to evaluate circadian rhythms, and one of these is the Morningness Eveningness Questionnaire, and another is the Basic Language Morningness Questionnaire, or BALM. So it's very important to determine if the scale that you're using is designed to screen or try to identify a certain sleep disorder, or if you have your research question in which you want to assess the severity of a certain sleep disorder, or are you trying to monitor changes in sleep due to an intervention. So keep in mind your research question when you decide which evaluation tool to use. Further, there are certain sleep questionnaires that are tailored to specific disease states. For example, I mentioned that I study Parkinson's disease, and 2 Parkinson's disease-specific scales are listed here: the Parkinson's Disease Sleep Scale and the Scales for Outcomes in Parkinson's Disease, or SCOPA, Sleep. The PDSS, for example, has been used in research outcomes related to rehabilitation, looking at how sleep changes due to an intervention such as Tai Chi or other rehab interventions. These questions can be specific to the disorder. For example, in Parkinson's disease, there are lots of leg kicks and acting out dreams, and these questions are addressed in the questionnaire. There are also questionnaires specific for sleep and multiple sclerosis, for example, the Neurologic Sleep Index, and there are also questionnaires specific to certain ages. Like for children, there's the Children's Sleep Habits Questionnaire. In conclusion, sleep is very important for many different aspects of health, and also it can influence response to different rehabilitation programs or different exercise interventions. There are multiple different tools that can be used to evaluate sleep in research settings. For example, polysomnography is the gold standard and is useful for evaluating sleep architecture, sleep-related breathing disorders, parasomnias, and sleep efficiency. Actigraphy is another objective measure that can be ideal for monitoring sleep and wake over a longer duration of time. And of course, subjective questionnaires can be very useful as well for evaluating sleep quality, screening for sleep disorders that may need further evaluation with objective measures, and also for monitoring severity of different sleep complaints. So thank you for your attention today, and keep in mind that sleep is important for every aspect of health and can be very useful for evaluating outcomes related to rehabilitation research. If you need additional information, please see these resources.